Application of Xunning Hemostatic Powder in endoscopic surgery. Xunning Hemostatic Powder is equipped with a disposable delivery catheter, approximately 34 centimeters in length, to meet the specific requirements of endoscopic surgery. One end of the catheter connects to the hemostatic powder bottle, while the other end is inserted through the endoscopper sleeve, reaching a distance of 1 to 2 centimeters from the bleeding surface. The surgeon then squeezes a bottle to apply an even and complete layer of hemostatic powder over the bleeding site, achieving a thickness of approximately 1 millimeter. Upon contact with blood, the melitosifs and hydrophilic groups of Xunning rapidly absorb moisture from the blood, or initiating a rapid dehydration process. This process instantly concentrates coagulation factors, platelets, fibrin, white blood cells, and red blood cells directly at the bleeding site. Simultaneously, it activates the endogenous coagulation cascade. A visible, white, gel-like matrix is then formed over the wound, providing a robust mechanical barrier that seals the site and significantly enhances the hemostatic effect.